My name is Bitsu Kiflu, Regional Technical Manager for Ruminants, Zoetis Sub-Saharan Africa. Today we will show you how to collect a milk sample aseptically for bacterial testing. Bacterial testing is a useful technique which we use to determine what pathogens are associated with the clinical and subclinical mastitis cases in our herd, and also to decide the prevention and treatment measures we need to decide in our farmers, and also to determine the effectiveness of the treatment we use during lactation and dry-off period. Proper sample collection technique is a useful technique which we need to use in our farmers every day. Aseptic techniques has to be followed always to prevent the contamination of our samples from microorganisms found in the cow teats, skin, udder, and the barn environment. Today we will show you how to demonstrate milk sample collection aseptically and the materials we need to do the testing. Before beginning the milk sample collection procedure, please prepare the following materials: teat dip solution, disposable gloves, clean towels, alcohol pads, milk sample tubes, permanent marker, a cooler with an ice pack. Now let's see how to do it. Step 1. Put a new disposable glove. Then label the sample tubes using a waterproof marker pen. Then clearly record the dates, the cow ID, and the quarter from which the samples will be taken. Step 2. Brush loose dirt, bedding, and hairs from the udder and teats, and thoroughly wash and dry grossly dirty teats and udders before proceeding with the sample collection. Step 3. Discard several streams of milk from the teats and observe for milk if there is clinical mastitis. Step 4. Dip all quarters in an effective pre-milking teat disinfectant and allow at least 30 seconds contact time. Step 5. Dry teats thoroughly with an individual towel. Step 6. Begin with teats on the far side of the udder. Scrub teats in this vigorously 10 to 15 seconds with an alcohol pad. Teats should be scrubbed until no more dirt appears on the swab or visible on teat end. Make sure you finish with the one that is closest to you to avoid contamination from any contact with your wrist or sleeve. Step 7. Once you have completed disinfecting the teats, proceed with the sample collection. Begin the sampling from the closest teat and move the teats on the far side of the udder. First, remove the cap from the tubes by holding it with your little finger. Hold the cap so that inside is facing towards the ground. Always keep the open end of the cap facing downward. Maintain the tubes or vials at an approximately 45-degree angles while taking the samples to avoid contamination. Without letting the tubes come into contact with the teeth, draw some milk into the tubes. Collect 1 to 3 streams of milk and immediately replace and tightly secure the cap. Do not overfill the tubes. When samples are taken at the end of milking or between milking, teeth should be dipped in an effective germicidal teeth disinfectant following sample collection. To complete the process, you must put all the samples immediately in an ice cooler, and samples to be cultured at a later date should be frozen. Finally, send the samples to the lab for microbiological analysis.